Glossary. Abnormal. Abscess. Acetaminophen. Advanced. Alignment. Amalgam. Anesthetic. Antibiotic. Antifungal. Antiseptic. Appliance. Arch. Artificial. Avulsed tooth. Bacterial infection. Benzocaine. Bite wing X-ray. Bleeding. Blister. Block. Bone graft. Braces. Bridge. Bruising. Brush biopsy. Bruxism. Bulla. Bumper. Cancer. Cancerous. Cankersore. Caries. Cartilage. Cavity. Cephalometric projection. Ceramic. Checkup. Chemotherapy. Chickenpox. Chlorhexidine. Chronic. Cleft lip. Cleft palate. Clench. Click. Cold sore. Complication. Composite. Comprehensive. Computed tomography. Contagious. Corticosteroid. Crossbite. Crown. Crust. Cure. Cyst. Decay. Deformity. Dental anesthesiology. Dental dam. Dentures. Diagnose. Difficulty. Disc. Discoloration. Disinfect. Dizzy. Dry socket. Erosion. Evaluate. Examine. Exodontia. Expose. Exposure. Extraction. Extraoral X-ray. Fill. Filling. Fissure. Fixed. Flap surgery. Fluoride. Formation. Fracture. Fungal infection. General anesthetic. Gingivitis. Glass ionomer. Gold. Grasp. Growth. Gum disease. Gutta percha. Halitosis. Headgear. Herpes simplex. Ibuprofen. Impacted. Implant. Incision. Indirect filling. Infection. Inhaled. Inspect. Intraoral. Intravenous. IV. Irrigate. Laceration. Lead apron. Lead collar. Lidocaine. Local anesthetic. Lock. Loose. Macrotrauma. Malocclusion. Mandible. Mastication. Measles. Medication. Muscle relaxant. Nauseated. Nitrous oxide. Laughing gas. Occlusal X-ray. Occlusion. Open bite. Open wound. Oral surgeon. Orthodontist. Orthognathic surgery. Osteoarthritis. Osteotome. Overbite. Over-the-counter. OTC. Pain. Palatal expander. Panoramic X-ray. Partial dentures. Patch. Penicillin. Periapical X-ray. Periodontal disease. Periodontitis. Pilocarpine. Pit. Plastic. Pocket. Pop. Porcelain. Post. Prescription. Probe. Prosthetic. Pulp chamber. Radiation. Radiation therapy. Radiography. Recede. Removable. Replacement. Restoration. Retainer. Rheumatoid arthritis. Ridge expansion. Rock. Root canal. Root planning. Sample. Scaling. Scalpel biopsy. Screen. Seal. Sedation. Sensitivity. Shape. Sideways. Simple extraction. Sinus graft. Sleep apnea. Sore. Sore throat. Space maintainer. Spread. Surgical extraction. Swelling. Symptom. Temporal bone. Temporary filling. Temporomandibular joint.
Tetracycline.
Thrush. Tissue. Tissue graft. Tomogram. Toothache. Topical anesthetic. Trap. Trauma. Tumor. Ulcer. Unconscious. underbite. UPPP. Avulopalato-pharyngoplasty. Veneer. Vesicle. Viral infection. Weaken.
Book 3, Unit 1, Dental Emergencies. Exercise 5, page 5.
Peacehaven Dental Clinic. Accidents and emergencies. Accidents happen, and we realize that we need to be there for you when one occurs. We have reserved a daily slot for accidents and emergencies from 10 a.m. to midday every weekday. Call us for an appointment, giving as much detail as possible about your condition. If your dental emergency happens at the weekend or after 6 p.m., when we are not available, there are several steps you can do yourself. These could make the difference between saving and losing a tooth. If your tooth gets knocked out, keep it moist. After rinsing the tooth off, try placing it back in the socket. Avoid touching the root. If that's not possible, keep the tooth in your mouth, between your cheek and gums. Alternatively, place it in whole milk or a preserving product. Then go straight to the hospital emergency room. If your tooth is cracked, rinse the mouth with warm water. Put a cold compress on your face to reduce swelling. If an object is stuck in your teeth, remove it using floss. Never use anything sharp to remove stuck objects. If you receive a burn to the mouth, get medical attention immediately because swelling could restrict breathing.
Exercises 6 and 7, page 5.
Hello, Peacehaven Dental Clinic. How can I help you?
One of my front teeth has been knocked out.
Ouch! Did it come out completely or did it break off?
It came out completely.
Okay. Is the tooth itself still whole or did it break into pieces?
It's all in one piece. Will the dentist be able to save it?
Yes, if you get to the clinic quickly.
Good. Is there anything I need to do to preserve the tooth until I get there?
Yes. Can you place it back into the socket?
I can try. Ow! No, it hurts too badly.
I think that means the root is exposed then. All right. I advise you to place the tooth in a cup of whole milk.
Really? That seems a little strange.
Yes, but the milk can keep the tooth's root cells from dying right away.
Who'd have guessed? Luckily, I have whole milk in my refrigerator. I'll put the tooth in some and head over to the clinic.
Great. I'll let Dr. Heaton know you're coming. Can I get your name, please?
It's Eric Lundquist. I'm a current patient of Dr. Heaton's.
Unit 2, Cosmetic Dentistry. Exercise 5, page 7.
Temple Cosmetic Dentistry. We've just opened our new cosmetic dentistry office on Temple Road. While traditional dental clinics focus on treating oral disease, our clinic focuses on elective treatments. Afterwards, you'll be feeling beautiful and confident about your smile. Our treatments include bonding. We can repair chipped, broken, or discolored teeth using our bonding procedure. The dentist may perform an enameloplasty to reshape the teeth. Then he will apply a composite material which resembles enamel. This will be sculpted and contoured to create a perfect, healthy-looking smile. Teeth whitening. Remove those ugly stains from smoking, food, coffee, and wine. Gingivoplasty. Reshape the gums around the teeth to promote a fresh, healthy smile. Smile makeover. Our dental consultants will give your smile a complete assessment and suggest ways to improve its appearance. Typically, several procedures will be recommended to achieve a dazzling new look. Full mouth reconstruction. While consulting you about your smile makeover, We may recommend treatment to correct functional problems with your bite and bone structure. If treatment is necessary, you can be assured that you will receive durable, clinically sound treatments to ensure your perfect smile lasts for a long time.
Exercises 6 and 7, page 7.
So, I've had a good look at your mouth, and I have some suggestions for your smile makeover.
Okay, go ahead.
One option is to conduct a gingivoplasty. Do you know what that is?
No, I have no idea.
That involves reshaping your gum tissue. It'll make your teeth look bigger.
Okay, what else can you do?
I'd like to reshape some of your teeth and make them look straighter.
Can you do that without me wearing braces?
Yes, I can give you an enameloplasty and bonding treatment to improve the shape.
Can you do anything about this chipped tooth?
Definitely. I can apply the composite to the tooth and sculpt it into the right shape.
Great. I've never liked the appearance of that chipped tooth.
We'll finish off with a teeth whitening procedure.
Sounds great. How long will it all take?
You'll need several appointments over the next week, but I can start right now.
Great. Let's start.
Unit 3, Pediatric Dentistry. Exercise 5, page 9.
Langham Pediatric Dentistry. At Langham Pediatric Dental Clinic, our focus is to provide dental care throughout the various stages of childhood, from birth to adolescence. We have worked hard to create a pleasant, kid-friendly environment. Gaining the trust and confidence of your children is very important to us. Our specialist treatment includes risk assessment for caries, preventative care and advice about cleaning and diet recommendations, counseling for habits such as pacifier use and thumb sucking that are harmful to teeth, early assessment and treatment for straightening teeth and correcting an improper bite, repair of tooth cavities, care for dental injuries such as fractured, displaced, or knocked out teeth. Our dentists, Dr. Malcolm Langham, DDS. Dr. Langham is a graduate from the University of North Carolina School of Dentistry. He completed 2 additional years of training in dentistry for children with special needs. In his spare time, he enjoys cycling and hiking. Dr. Mimi Mueller, DDS. Dr. Mueller graduated from Harvard School of Dental Medicine and completed her residency in pedodontics at Springville Children's Hospital. She enjoys cooking and reading in her free time.
Exercises 6 and 7, page 9.
Hi, I'm Mary. I don't think we've met.
I'm Sam. No, we just moved here. This is the first soccer practice we've been to.
Well, welcome to Springville. How do you like it so far?
We're enjoying it, although we're still trying to get settled in.
I've lived here my whole life, so if you need any recommendations or information, just let me know.
Actually, maybe you can help me out now. We're trying to find a good pediatric dentist for the kids.
I highly recommend the Langham Clinic. Dr. Langham and Dr. Mueller are both great with children.
What kind of services do they provide?
Oh, the usual things like preventative care, fillings, early assessment for orthodontic problems.
Our youngest daughter refuses to give up her pacifier, and we're worried it's going to harm her teeth.
We had the same problem with our son. Dr. Langham gave us some really useful tips for breaking the habit.
I'll definitely give them a call then.
I have one of the clinic's business cards in my car. Let me go get it for you.
That would be great. Thank you.
Unit 4, Geriatric Dentistry. Exercise 5, page 11. The Importance of Population Statistics in Dentistry by Neil Sedgmore. Currently, almost 15% of the American population is over the age of 65. By 2040, this figure is estimated to increase to 23%. Some rural and coastal regions already have a higher proportion of seniors than this. Dentistry is one of many industries affected by the aging population. Professionals who specialize in geriatric dentistry are already much in demand. A number of dental issues are specific to elderly patients, whether they are edentulous or retain their own teeth. One common problem is xerostomia, or dry mouth. This often results as a side effect from taking medications. Dry mouth can affect a person's ability to speak, taste, and eat. They may be in more pain, and gum disease can develop faster. Older patients suffering from diabetes mellitus are at greater risk of oral infections. It is also believed that systemic diseases, such as osteoporosis and diabetes, can lead to periodontal diseases. Clinics in areas with large elderly populations need to bear a number of things in mind. It's not enough just to hire dentists who have specialized in geriodontics. Appropriate equipment, such as wheelchair-accessible chairs, is necessary. Clinics should also consider investing in a mobile unit in order to visit patients in nursing homes. Exercises 6 and 7, page 11.
Good afternoon, Sybil. Would you like any help getting out of your wheelchair?
No, thank you, dear. I can manage. There we are.
Good. So, how is your overall health these days, Sybil?
Oh, not great. I'm having a lot of trouble with my hips.
You have a touch of osteoporosis, is that right?
Yes, I think that's what they call it. It's very painful anyway.
I'm sorry to hear that. Well, shall I take a look in your mouth?
Yes, of course.
I see you retain all of your own teeth. That's good.
Yes, I'm glad I don't have to wear dentures.
But you have a bit of xerostomia. That's dry mouth. Is that making life difficult for you?
Oh, yes. My mouth has been feeling dry lately. It makes it very hard to chew and swallow. I think it's because of my medication.
Yes, that does happen. Unfortunately, though, dry mouth and systemic diseases like osteoporosis do increase the chances of gum disease.
Oh dear, can they?
Yes, so it's really important to take extra good care of your teeth and brush twice daily.
Well, I admit I don't always do that, but I'll make sure I do now.
Unit 5, Nutritional Counseling. Exercise 5, page 13.
Chapter 24, Nutritional Counseling. In some situations, it may be necessary to counsel dental patients regarding nutrition. This is necessary if a patient is suffering from recurrent decay, periodontal disease, or early childhood caries. These conditions indicate a high consumption of junk food, such as chips and candy. Mothers may need nutritional counseling if babies are suffering from baby bottle syndrome. That is, if they are allowed to sleep while sucking on a bottle containing sugary soft drinks. A formal or informal approach can be taken to counseling. Informally, the dentist can use visual aids and brochures to discuss their general attitude to food. The dentist can ask the patient for a 24-hour food recall. A formal approach might involve asking the patient to record a weekly food diary. If there is an underlying medical condition affecting food intake, such as nutrient deficiency disease, the dentist should refer the patient to a dietitian. In all cases, the patient's lifestyle must be taken into account. Be aware of cultural influences that affect diet. Consider the patient's level of education and current health status. Finally, be sensitive towards the patient's financial status. This may put restrictions on the type of food they consume.
Exercises 6 and 7, page 13. I'm afraid you have a couple of cavities. I'll need to fill those.
Oh no, I hate getting fillings.
I'm guessing you have a bit of a sweet tooth, don't you?
I suppose I do.
Let me just get one of my visual aids. Here we are. Can you look at these pictures and tell me which foods you eat regularly?
Okay. Well, I don't drink milk. I don't like it. I don't eat yogurt either. And I never eat vegetables.
Okay, and can you recall what you ate yesterday?
I had chocolate muffins and juice for breakfast. For lunch, I had a burger. And for dinner, I had pizza. And I had candy and chips for snacks.
I see. Well, the problem is your diet is preventing you from having healthy teeth.
Really?
Yes, I'm quite certain you're consuming too much sugar.
Oh, I see.
I'm going to give you a brochure about nutrition. It will tell you the best foods for your teeth.
Okay, thanks.
If you find it hard to keep a healthy diet, I can refer you to a dietitian. She'll give you ways to stay on track.
Okay, thanks for your help.
Unit 6, Patient Referrals. Exercise 5, page 15.
Park Hill Practice, Guidelines for Referring Patients. Dentists have an ethical obligation to make arrangements for any necessary care for their patients. In some cases, primary care dentists may need to refer patients to a specialist. The primary care dentist is known as the referring dentist. He or she coordinates with the consulting dentist. This ensures that the role of each dentist is clear. Patients may visit or be referred to specialists for consultations. Upon completion of their care, specialists should return the patient to the care of the referring dentist. The exception is if the patient reveals a preference for a different dentist. A dentist could be held liable for poor treatment performed by a consulting dentist. Therefore, referring dentists must assess the qualifications of consulting dentists before issuing a referral. In some cases, a specialist may be asked to give a second opinion regarding treatment or diagnosis. The dentist giving the second opinion should give an objective recommendation. Dentists must not unjustly imply that a patient has been mistreated. It can be difficult to determine whether or not such comments are justifiable, but it is possible to conduct an inquiry using the proper channels.
Exercises 6 and 7, page 15.
Dr. Farmer speaking.
Hi, Mark. It's Lucy Rivers from Highland Dental.
Hello, Lucy. What can I do for you?
I have a patient referral for you. Her name's Michelle Oliver. She requires orthodontic treatment.
Well, I'm booked solid for several months, but our new orthodontist, Dr. Anna Fredericks, can see her.
I didn't realize you had a new orthodontist. Can you send us a copy of her qualifications, please?
Why do you need them?
We have an obligation to our patients to ensure they're getting proper care. Otherwise, we may be liable.
I understand. I'll ask my office manager to fax them to you.
Great. After we verify Dr. Frederick's qualifications, I'll send over the patient's chart and x-rays. Then Dr. Fredericks won't need to assess her again.
Sounds good. After we get those, the receptionist can schedule her consultation.
Okay. Will the receptionist contact her directly about that?
Yes. Just make sure her contact information is in the chart, please.
No problem.
Unit 7, Patient Health History. Exercise 5, page 17.
Patient Health History Questionnaire. Personal information. Full name, Benjamin Michael Dodson. Date of birth, February 3rd, 1962. Address, 4520 West Smith Street, Sarasota, Florida, 34231. What is the best phone number for us to reach you? 941-435-6734. What is the reason for today's visit? Checkup and cleaning. Medical information. Who is your primary care physician? Dr. Robert Unger. Primary care physician's address, 3462 East Portland Avenue, Sarasota, Florida, 34246. Primary care physician's phone number, 941-454-5473. Date of your last physical examination, February 23rd, 2013. Have you ever had a serious illness, operation, or been hospitalized? If so, please explain. Yes, last year I was hospitalized after a car accident. I had a broken leg and several broken ribs. Have you ever had an allergic reaction to food, medication, or latex? Yes, mushrooms give me a rash or fever and minor swelling. Have you ever been treated for mental health problems? If so, please explain. No. Are you currently taking any medications? If so, what is your dose frequency? Yes, I am taking medication to help regulate my blood pressure. I take it once a day. Do you use tobacco? No. Do you drink alcohol? If so, how frequently? Yes, I drink wine twice a week. For women, are you pregnant?
Exercises 6 and 7, page 17.
I need some personal information from you regarding your health history.
I thought I responded to everything on the questionnaire that I filled out.
Yes, but I need a bit more detail to complete your medical information.
Okay.
You mentioned that you had an operation last year.
Yes, that's right. I had my appendix removed.
I see. For how long were you hospitalized?
Just for 3 days.
All right. One more question. You wrote that you are allergic to pain medication.
Yes, I had an allergic reaction to some medication that the doctor prescribed after my surgery.
Do you recall what it was?
I'm afraid I don't remember the name. You'll have to check on that with my physician.
And you said that it was prescribed after the removal of your appendix, right?
Yes, I took it once. I broke out with a skin rash and had a fever. I tend to avoid strong pain relievers as a result.
I understand. I'll give your doctor a call later.
Unit 8. Chronic Illness. Exercise 5, page 19.
Oral health and chronic illness. The connection. You know that good oral health is important, but did you know it affects more than just your mouth? Research shows a link between poor oral health and chronic illnesses. Increasingly, doctors and dentists are taking a holistic view of patient health. The mouth provides vital information about the body and vice versa. Links with diseases. Patients with gum disease double their chances of getting heart disease. There is a correlation between tooth loss and stroke risk. There is also an association between bad oral health and kidney disease. Diabetes is a bit more complicated. There is a two-way relationship between diabetes and gum infections. Research suggests that diabetics are more prone to gum infections. In addition, gum infections are a contributing cause of prediabetes. Inflammation in the mouth reduces the body's control over blood sugar. Claims have been made about a connection between osteoporosis and gum disease. However, this is still unverified. What does this mean for you? It is more important than ever to update your dental files. Let us know if you have a family history of chronic illness. Also inform us if you receive a new diagnosis. We need the complete picture to offer you the best care.
Exercises 6 and 7, page 19.
Thank you for telling me about your heart disease diagnosis.
Well, I figured I should keep you in the loop.
I appreciate that. Now, are you familiar with the connection between gum disease and heart disease?
Yes, but I don't really understand the link.
That's okay. Neither do medical professionals. But 91% of patients with heart disease also have gum inflammation.
That's a really high percentage. It certainly doesn't sound like a coincidence.
Agreed. The working theory is that inflammation in the mouth results in inflamed blood vessels.
Okay, I'm with you so far.
Well, inflammation in the blood vessels isn't good. It elevates blood pressure. It can also lead to heart attacks and strokes.
That sounds really scary.
It's okay. That's where I come in.
How can you help?
Well, I plan to keep your mouth in great condition, and I'm going to show you how to improve your oral hygiene.
I'm on board.
Great. Here's a pamphlet about oral hygiene. Go ahead and read it and ask if you have any questions.
Sure.
Unit 9. Special Needs Patients. Exercise 5, page 21. Treating special needs patients. General dental practices often need to treat special needs patients. There are not enough specialized dentists to handle this population. Some dentists doubt their ability to treat people with disabilities, but general practitioners can usually work around mild to moderate disabilities. Who is a special needs patient? Special needs patients require a change to the standard treatment approach. There are many people who fall into this category. Not all of them have severe handicaps. Some of these patients may have physical limitations. These can range from minor mobility issues to a developmental disability. Mentally ill people may be special needs patients. No two special needs patients are the same. Forget about stereotypes and focus on the individual. How to provide appropriate care for this population. Good dentists have certain characteristics. They show compassion and understanding. They treat patients with respect. This approach is even more important for special needs patients. Ask about the patient's condition before their appointment. If necessary, research it so you are aware of factors that might affect treatment. Think about the best ways to accommodate them. Be flexible with scheduling and keep appointments short. Many dentists worry about seeing special needs patients. However, this population needs dental care too. So forget about the fear and concentrate on your training. Exercises 6 and 7, page 21.
I'd like to make a dental appointment for my son, but he has special needs.
Okay. Does he have a physical limitation or is he mentally ill?
Jake has autism. Do you have experience treating an autistic child?
Actually, I currently have 2 children who are autistic as patients. Both those cases are mild, though.
I wouldn't say my son has severe autism.
So it's moderate?
It's hard to measure the severity of autism.
I don't mean to put you on the spot. I just want to figure out how best to treat him.
I appreciate that. How do you typically treat autistic patients?
My current patients have issues with change, so I use the same assistants every time.
Jake would like that.
I also make a note of which room I use.
So it's the same each visit?
Yes, we have a 24-hour cancellation policy, but we waive that for patients with disabilities.
Okay, I'd like to make an appointment. We could do any Monday or Tuesday morning.
Then I'll schedule Jake for this Tuesday at 10 a.m.
Unit 10. Patient Anxiety. Exercise 5, page 23.
Green and Jessup Dental Practice, Warner Road, Pelham. Do you experience anxiety visiting the dentist? If so, you are not alone. 75% of people surveyed find dental visits stressful, and up to 10% have a real phobia. This leads to a cycle of avoidance, where people only seek dental help in emergencies. Such emergencies require invasive treatment, and this reinforces their fears. You may be anxious because of a direct experience. Perhaps you had painful surgery in the past, or it could be based on indirect experience. Maybe friends have recounted traumatic dental experiences and you developed a fear through vicarious learning. Or you could have read or heard stories in the mass media. Many stories and films depict dentists as cruel, with patients undergoing treatment in a state of helplessness. Such stimulus generalization inevitably results in trauma. We at Green and Jessup Dentistry want to help you feel positive and relaxed about your visit. That's why all our dentists practice the tell, show, do technique. This is proven to help patients feel relaxed and in control. If you feel anxious during your procedures, please talk to your dentist.
Exercises 6 and 7, page 23. Good morning, Stacy Willis, isn't it?
Yes, that's right. I'm here for my root canal.
Take a seat. You're looking a bit pale. Are you all right?
I'm feeling a bit anxious. I don't really like coming to the dentist.
Many people find it stressful, but there's nothing to worry about.
No, my friend had a root canal and she said she was in pain for a week.
We often develop fears from indirect experiences, but our own experiences are never as bad.
I don't know. I saw a movie where a woman had invasive dental surgery and she could never taste food again.
I can see where that would cause disturbing thoughts, but you know that not everything you see in movies or on TV is real.
Well, it gave me a real phobia about dental treatment.
I understand, but this procedure is really straightforward. Here, I'll show you what's going to happen.
How?
Look up there on the screen. You'll see a diagram of the process.
Hey, that's pretty cool.
It is, isn't it? And if you feel stressed at any time during the procedure, just raise your arm and I'll stop.
Okay, I think I'll be all right now.
Unit 11. Communicating with patients. Exercise 5, page 25.
Patient Communication by Dr. Emily Lucas. As a dentist, I'm most concerned about doing my job properly. I need to treat patients' teeth in the best possible way. But competence is not the only quality a dentist needs. Dentists must also be caring. They must be compassionate towards their patients. Only this way will patients have true confidence that the dentist wants to help them. How can dentists show their patients that they care? Well, first off, you don't have to rush into treatment as soon as the patient arrives. Take time to chat. Show an interest in their lives. Ask them about their hobbies or compliment them on their appearance. Don't just give a general compliment like, "You look nice today." Point out something specific like a bright sweater or a new haircut. Be honest and maintain eye contact. This will show patients that you are confident and self-assured. At the end of the appointment, write down what you learned about the patient during your conversation. Patients are always appreciative if you can remember details about their lives and accomplishments. By following these steps, you will see a huge improvement in dentist-to-patient interaction.
Exercises 6 and 7, page 25.
Good afternoon, Rachel. Come in.
Thanks.
Wow, I like your jacket. Is it new?
Yes, I got it just a couple of weeks ago.
The color really suits you well.
Thanks for the compliment.
By the way, I read about your accomplishment in the local paper. A full scholarship. That's fantastic.
My parents certainly think so. I'm surprised you saw the article.
Well, I like to take an interest in what my patients are doing. So, you're going to college in the fall?
Yes, I am.
Will you be able to continue your hobbies while you're there? You know, climbing and canoeing?
I hope so. I'm surprised you remember so much about me. Do you write things down about your patients?
Well, just a note or two in their charts. I have quite a few patients, so if I don't write things down, I'll forget or get them mixed up.
I think that's great. I'm sure it makes all your patients feel important.
That's what I'm hoping for.
Unit 12. Sustainability in Dentistry. Exercise 5, page 27.
Many dental practices are taking measures to improve sustainability. By doing so, they are reducing the impact the dentistry profession has on the environment. If you are interested in making your dental practice more eco-friendly, here are some things to consider. Use of electronic health records saves paper, not to mention space. Also, try to file electronic insurance claims for your patients to reduce paper waste. Implement digital radiography. You won't have to dispose of the fixer and developer needed to develop traditional X-rays. Invest in an amalgam separator to prevent harmful mercury from entering the practice's wastewater. Amalgam is not separated at wastewater treatment facilities. As a result, it may be released into public water supplies. Choose energy-efficient machinery and low-flow water fixtures whenever possible. You'll lower your consumption of natural resources and save on utility bills. Recycle as much as possible. Materials that instruments are wrapped in, such as paper and plastic, can be recycled. In addition, some materials such as amalgam and lead foils for X-rays can also be recycled. Dispose of hazardous waste properly to avoid pollution of land and water. These are just a few things you can do. There are numerous ways to make your practice more eco-friendly. Visit www.greendentist.com/sustainability for more information.
Exercises 6 and 7, page 27.
I've been thinking about ways to improve the practice's sustainability.
You do realize that implementing improvements costs money, right?
Yes, but I think in some aspects it will pay off in the long run.
Such as?
Energy-efficient appliances and low-flow water fixtures. They'll cut down on our utility bills and help conserve natural resources.
Maybe. What else do you have in mind?
I was thinking of switching to electronic health records.
I'm with you on that. We won't need all those bulky filing cabinets anymore. And of course, it will save paper.
I'm glad you agree on that one.
We should also consider sending email appointment reminders to patients instead of the postcards. It will cut down on paper waste and postage.
Good idea. Now, for my other idea, I want to get an amalgam separator.
Aren't those really expensive?
They're under $1,000.
Really? I thought they cost more than that.
Me too, but I did some looking online and I found several brands for around $700 to $900.
Well, let me do some numbers on what these things will actually cost. Then we'll decide on getting them.
Unit 13. Obtaining licensure. Exercise 5, page 29.
All dentists are required to obtain licensure to practice dentistry. Candidates for licensure apply to a governing agency in the location where they want to practice. Licensure requirements can vary from place to place, but usually there are 3 basic requirements. These are an education requirement, written exam requirement, and a clinical exam requirement. A board usually sets forth the requirements for licensure. It also determines if a candidate should be issued a license to practice dentistry. In some places, dentists may also have to apply for specialty licensure. It allows them to practice in the specialty fields of dentistry, such as orthodontics or prosthodontics. Specialty licensure requirements may include passing a specialty clinical exam. Specialists may also need to provide proof of additional education in the specialty area. If a dentist relocates, he or she may have to get a new license specific to the area through the local licensure authority. In most cases, this does not require meeting any additional requirements. In addition to issuing licenses, agencies can also take them away if dentists are shown to have engaged in misconduct. They are in charge of disciplining dentists whose behaviors are not suitable for a member of the profession.
Exercises 6 and 7, page 29.
Hi, Mark. Did you get the results of your written exam yet?
Yes, I passed.
That's great, so did I. But now we have to worry about the clinical exam.
I actually had a nightmare last night about it.
What happened?
Well, I thought I did well, but when I went before the board, they told me I failed.
Oh, no.
Yes, but that's not all. They also told me I didn't graduate from dental school. I had to go back and redo my education requirement.
That's terrible.
It was. I was sweating when I woke up.
At least it was only a dream. By the way, I wanted to ask you if you want to study for the clinical exam together.
Sure. After all, you were the top of our class when it came to diagnosis.
And you got the best grades in endodontics and periodontics.
Maybe we should ask Hannah Lee and Ethan Burke if they want to create a study group.
Because Hannah and Ethan were great at prosthetics and restorations?
Yes. With all of us studying together, I don't see how we can fail the clinical exam.
Unit 14. Establishing a dental practice. Exercise 5, page 31. After completing their studies, new dentists are faced with a choice. Do they start up their own private practice, or do they find employment with an existing practice? If having your own practice is what appeals to you, here are some guidelines to help you on your way. Talk to dentists that establish their own practices. They can give you ideas about what kind of capital is needed to start your practice. Ask about banks that can provide funding for your endeavor. Also solicit advice on drawing up a successful business plan. You will need one when applying for loans. After obtaining funding, decide if you are going to rent a space in a building or build your own office. Apply for any necessary business or building permits from your local government agencies. Next, purchase equipment and hire staff for your practice. Advertise job vacancies in the newspaper or on internet job boards. Have a staff orientation before opening so you can discuss your expectations with them. Finally, you'll need to market your practice to potential patients. Run ads on radio stations and television, and offer discounts to patients who give word-of-mouth referrals. Also consider hiring a web designer to create a website for your practice. Exercises 6 and 7, page 31.
I did some research on what we need to do to open our private practice.
Me too. It looks like the biggest thing is getting enough capital to start up.
Yes, and I called Dr. Jaredson. You remember him, don't you? He used to give guest lectures at school sometimes.
Of course. He has a very successful private practice, doesn't he?
Right. I was hoping he could give us some advice.
That was a really good idea. What did he say?
Well, he actually suggested something that we didn't think of.
Which is?
We could buy an existing practice from a dentist that is moving or retiring. That way, we wouldn't have to build a practice from the ground up.
That's actually not a bad idea. We still need funding to buy an existing practice, of course.
But we'd have equipment, premises, and an established client base in place already.
That would definitely allow us to get started quicker.
So, do you think that might be a better route for us to pursue?
Yes, I do. I'm really glad you made that phone call.
Unit 15. Ethics in Dentistry. Exercise 5, page 33.
Dentists have a code of ethics that governs how they should act. There are 5 principles in the code which dentists are expected to uphold. The first principle is patient autonomy. Patients have the right to accept or refuse treatment after a dentist informs them of what is needed. Also included in this principle is confidentiality. Dentists must keep details about their patients' treatments private. The second principle is non-maleficence, or do no harm. Dentists should keep their education current and train in new procedures to provide the best care to patients. They also must consult with or refer patients to specialists for diagnoses out of their range of knowledge. The third principle is beneficence, or do good. Dentists are required to promote the welfare of patients and people in general. Under this principle, they are expected to report any abuse or neglect of their patients to authorities. They are also encouraged to engage in community service. The fourth principle is justice, which ensures fair treatment of patients. Dentists may not refuse to treat patients based on race, gender, nationality, or color. The fifth principle is veracity. Dentists must be honest and demonstrate integrity in their dealings with patients and insurance companies. They cannot make false claims regarding fees or treatments.
Exercises 6 and 7, page 33.
Hi, Jean. Did you see this morning's paper?
No, what did I miss? Is there something interesting in it I need to see?
Dr. McGregor from the Chatham Clinic has been charged with an ethics violation.
I thought you were going to tell me about some new dental treatment being performed in Europe or something of that sort.
It's pretty shocking, isn't it?
Yes, especially since we referred some of our patients to him in the past. What happened?
Apparently, he attempted to perform a procedure on a patient that he wasn't really familiar with.
Attempted? That makes it sound like...
It went terribly wrong? I'm afraid it did.
Oh, no. Well, thank goodness we started referring to our patients to Dr. Beaumont instead.
Yes, I don't think we have to worry about her violating the non-maleficence principle.
I know some of the patients that were referred to Dr. McGregor didn't think he was honest.
I remember Mrs. Garcia saying he tried to pressure her into a gum graft surgery she didn't need.
That's right. In fact, after she told us that, we switched to Dr. Beaumont for periodontal referrals.
Glossary. Abuse. Accessible. Accident. Accomplishment. Adolescence. Age. Agency. Alcohol. Allergic reaction. Amalgam separator. Anxiety. Appearance. Appreciative. Arrangement. Assess. Association. Authority. Autonomy. Baby bottle syndrome. Basic. Beneficence. Birth. Board. Bonding. Burn. Business plan. Candidate. Capital. Caring. Chat. Childhood. Chipped. chronic illness, clinical exam, cold compress, community service, compassion, compassionate, competence, complement, confidence, confidentiality, consultation, consulting dentist, consumption, contour, conversation, coordinate, correlation, cosmetic dentistry, cultural, cycle of avoidance, detail, developmental disability, diabetes, diabetes mellitus, diet, dietitian, direct experience, disability, discolored, dose frequency, edentulous, education, elderly, elective, electronic health record, emergency, employment, enameloplasty, energy efficient, environment, equipment, establish, ethics, factor, financial, food diary, full mouth reconstruction, funding, geriatric, geriodontics, gingivoplasty, habit, handicap, harm, heart disease, helplessness, hobby, holistic, honest, hospitalize, illness, indirect experience, inflammation, inquiry, integrity, interaction, interest, invasive, issue, junk food, justice, kid-friendly, kidney disease, latex, liable, licensure, link, loan, lose, low flow, market, mass media, mental health, mentally ill, mild, milk, mobile unit, mobility, moderate, moist, neglect, non-maleficence, nursing home, nutrient deficiency disease, nutrition, obligation, operation, osteoporosis, pediatric, pedodontics, permit, personal information, phobia, physical limitation, physician, pollution, preference, pregnant, preserve, preventative care, private, prone, qualification, reason, recall, recycle, reduce, refer, referring dentist, reinforce, rent, report, requirement, reserve, restriction, retain, rinse, roll, save, sculpt, second opinion, self-assured, senior, severe, smile makeover, soft drink, special needs, specialty licensure, stage, stain, start up, stereotype, stimulus generalization, stressful, stroke, stuck, sustainability, systemic disease, tell, show, do technique, tobacco, traumatic, trust, understanding, vacancy, vary, veracity, vicarious learning, visual aid, waste, wastewater, welfare, wheelchair, whitening, word of mouth, write down, written exam, xerostomia,